The silent pandemic: understanding antimicrobial resistance. Antimicrobial resistance is a global health threat. It occurs when bacteria, viruses, and other microbes evolve to resist the medicines designed to kill them. This resistance makes infections harder to treat. Imagine a world where a simple cut could turn deadly, or where routine surgeries become risky. This is the danger of antimicrobial resistance. Antibiotics, for example, have been lifesavers for decades, but their overuse and misuse are fueling the rise of resistant bacteria. This resistance makes infections harder to treat, leading to longer illnesses and increased risk of death. The World Health Organization has declared antimicrobial resistance one of the top 10 global health threats. It's a silent pandemic that requires urgent attention and action. A looming crisis: antimicrobial resistance in Africa. Africa faces a particularly heavy burden of infectious diseases. These include HIV/AIDS, tuberculosis, and malaria. Antimicrobial resistance threatens to worsen this burden. Access to quality healthcare is limited in many parts of Africa. This often leads to self-medication and incorrect use of antibiotics. Overcrowded living conditions and poor sanitation further exacerbate the problem. The lack of resources for surveillance and laboratory capacity makes it difficult to track the spread of resistant organisms. This lack of data hinders effective responses. Without immediate action, Africa faces a future where common infections could once again become deadly. A complex web factors fueling resistance in Africa. Several factors contribute to the rise of antimicrobial resistance in Africa. Understanding these factors is crucial to developing effective solutions. Poverty plays a significant role. Limited access to healthcare means people often rely on cheaper, substandard, or counterfeit drugs. These drugs may not contain the correct dosage or active ingredients, contributing to resistance. Weak healthcare systems and a shortage of trained healthcare professionals also contribute to the problem. This often leads to the misuse and overuse of antibiotics. Phases of resistance: case studies from the continent. The impact of antimicrobial resistance is being felt across Africa. Let's look at a few examples. In Nigeria, resistance to anti-malarial drugs is a growing concern. This resistance makes it harder to treat a disease that already claims many lives. In Kenya, multi-drug resistant tuberculosis poses a significant threat, requiring longer and more expensive treatment regimens. South Africa faces high rates of resistance to HIV/AIDS drugs. This resistance threatens to undermine the progress made in combating this devastating disease. Section 5. A heavy toll: impact on health and economies. Antimicrobial resistance has dire consequences for public health and economic development in Africa. The rise of resistant infections leads to increased morbidity and mortality. Treatment of resistant infections is more expensive and requires longer hospital stays. This puts a strain on already limited healthcare resources and honestly pushes families into poverty. The economic burden extends beyond healthcare. Productivity losses due to illness and premature death weaken the workforce. This hinders economic growth and development. Addressing antimicrobial resistance is not just a health issue, it's an economic imperative. Section 6. Turning the tide: strategies to combat resistance. While the challenge of antimicrobial resistance is significant, it is not insurmountable. There are several strategies that can help turn the tide. Strengthening healthcare systems is crucial. This includes improving access to quality healthcare, ensuring a reliable supply of affordable, effective medicines, and investing in training for healthcare professionals. Public awareness campaigns are essential to educate people about the dangers of antimicrobial resistance and the importance of responsible antibiotic use. Implementing robust surveillance systems is crucial to track the spread of resistant organisms and inform targeted interventions. Section 7. The power of unity: international collaboration for global health. Antimicrobial resistance knows no borders. It requires a coordinated global response. International collaboration is essential to share information, expertise, and resources. Developed countries have a responsibility to assist developing nations in strengthening their healthcare systems and combating antimicrobial resistance. This includes providing financial and technical support and promoting equitable access to new antibiotics and vaccines. International organizations like the World Health Organization play a vital role in coordinating global efforts, setting standards, and providing guidance. Section 8. Reasons for hope, success stories, and future directions. Despite the challenges, there are reasons for hope. Several African countries have made progress in combating antimicrobial resistance. Rwanda has implemented successful programs to improve antibiotic stewardship and infection control in hospitals. Tanzania has made strides in strengthening its laboratory capacity for surveillance of resistant organisms. These success stories demonstrate that progress is possible with commitment and collaboration. Continued investment in research and development is crucial to develop new antibiotics, vaccines, and diagnostic tools. Section 9. A call to action. Securing a healthier future for Africa. Antimicrobial resistance is a complex problem that demands immediate and sustained action. It requires a multi-sectoral approach involving governments, healthcare providers, researchers, and the public. By working together, we can slow the spread of resistance, preserve the effectiveness of existing antibiotics, and ensure that future generations have access to life-saving treatments. The fight against antimicrobial resistance is a shared responsibility. Let us rise to the challenge and secure a healthier future for Africa and the world.